Throughout history, pandemics have devastated humanity, but none quite like the Spanish flu of 1918, when a deadly influenza virus swept across the globe, creating one of the deadliest health crises in human history. 1. The unprecedented scale. This devastating outbreak infected approximately one-third of the world's population, affecting people in the most remote corners of the Earth as the virus spread with terrifying speed across continents, claiming between 50 and 100 million lives in just 2 years, making it deadlier than the entire First World War that had just concluded. 2. The unusual victims. Unlike typical influenza strains that primarily threaten the very young and elderly, this virus targeted healthy adults in the prime of their lives, with those aged 20 to 40 experiencing the highest mortality rates as their robust immune systems overreacted to the infection, causing a cytokine storm that filled lungs with fluid and led to rapid death within hours or days. 3. The wartime spread. The ongoing global conflict accelerated transmission as soldiers lived in crowded trenches and military camps, creating perfect conditions for the virus to mutate and spread before returning home to their families, carrying the infection to every corner of their nations and beyond. 4. The public health response. Cities implemented measures that seem familiar today, including mandatory mask wearing, social distancing requirements, and the closure of schools, theaters, and churches, as officials struggled to contain the outbreak, while newspapers downplayed the severity to maintain wartime morale, leading to confusion and mistrust among populations already exhausted by years of conflict. 5. The lasting impact. This catastrophic pandemic transformed modern medicine, leading to advances in virology, epidemiology, and public health infrastructure that continue protecting humanity today, reminding us that invisible threats can prove more devastating than any war.